I'd like to introduce the second panelist, Professor Nguyen Huong. She is an associate professor and former vice rector of Hanoi University of Public Health in Vietnam. She has 30 years of experience in teaching, research, and providing consultancy in health policy and management, health promotion. She has been leading and involving in a member of research project of health policy and system health promotion interventions. She has also worked as a national consultant for a number of international agencies too. So now let us welcome Professor Nguyen Huong. Thank you.
To be
Hey, Jeff. Uh,
to present in this conference, and I am a public health specialist, not sociologist, but I work a lot in the fields of social determinant of health and health policy. So it is really my pleasure, and would like to share with you some experience from Vietnam when we fighting with COVID. So I will try to share my screen. Have you? Yeah. Hopefully it work out. Is that okay? Okay. So my presentations focus on how the Vietnamese government respond to COVID-19, and certainly we have some successful now, and but we have a lot of challenge. So I would like to share with you and to discuss with you how to set success, but very importantly, how to work together to overcome the challenges. So just briefly about Vietnam for no for whom not know very well about our country, but we are a very populated with nearly 100 million people. We have quite good life expectancies with nearly 74 years, and our GDP before COVID-19 is 2019 is increased quite fast and not, I mean, not very high, and we are in the group of lower middle income countries. And our religion is mainly Buddhism, and the politics is one party, this Communist Party. Um, you know that our country is started uh, belong to the lower middle income country in 2010s, and since then the government is really trying to develop our social protection system that meet international standard. And you know that the party also have the duration, and we try to, by 2020, we try to be basically achieve social security for the whole population. We also ensure minimum level income, education, housing, clean water, and information for our population. And we gradually enhancement of income, ensuring security, living and happiness of the people. And very interesting that for several international surveys showing that Vietnamese people is in the uh, list of the top country ever a high indicator of happiness. And we have number of public policy and public health policy and program for the children rights and well-being of the youth, women and aging. And especially in terms of health insurance, we follow the universal health coverage, and at the moment we cover about nearly 90% of our population. And especially we have free health insurance card for all children under 6 and for the poor, and cover 80% for the near poor. And just have a quick look on some example of health policy support for the poor. Over time, we increase the support for this group, and you can see that at the current, we have some kind of free health insurance card. 100% of the poor is have free health insurance cards, and also we have other health policy toward the poor and also the near poor. As I said that the near poor also have a support for 80% of the money to buy the health insurance card. Since the world is facing with the COVID-19 ongoing pandemic, Vietnam is not exception. But as you can see, maybe through the media, you can see that Vietnam is considered as one of the country have some really success in terms of fighting that ongoing pandemic. And I would like to share with you some kinds of success that we achieved so far. Uh, the first thing, we think that we control or curb COVID-19 outbreak with certain socio-economic development. So you can see that I will give you some figure after this, but at least we are in the group of the country have a good control of the pandemic. We also ensure food security for the population by a number of policy. But one of the example is that we, as a third country export of rice, we monitor rice export closely during the COVID to, I mean, support for the ensure the food security for our population. Looking at the GDP growth rate, and you can see that during the time of, you can see the figure from the 2011 to 2020 for the second quarter of the year. Even the GDP is reduced dramatically for Vietnam, but you can see that it's still positive increase, it increasing, and it is 0.36%. And you can see that compared with many countries in the region and in the world, this can see as a positive economic development. And also for international survey recently showing that more than 30% of the participants in Vietnam thinking that Vietnam is doing right amount of the policy and the measure to control of the uh, epidemic. And Vietnam is the highest percentage among the 45 country surveyed. So here it is just very quick some figure showing so far we we have only 100 1097. Today is 97 with one new case come from fly from Dubai, and we can say that we no new case in the community after 33 days now. So it is really good, simple of how we prevent and control of the spread of COVID. And also why we how we do what kind of response of the government to fighting the pandemic. And in the screen you can see some kind of main measure and very quick response from the government. The first one is the government demonstrated prompt and quite aggressive, very strong responsive in the fight with the pandemic. For example, Vietnam is the first nation after China to put a large residential area in the isolation zone. For example, we isolating infected people and tracking down their contacts and community or village where was at risk of the pandemic. And you know that we do it not one time for the whole country, but then we tracking the high risk area and close just only that area. The other area we continue with some kind of social economic policy that keep our economic is not reduce reduction dramatically. And we also stop issue visa for foreigner from infected nation. And at the moment we starting to provide visa again for special group of people like expert, high skilled worker to come to Vietnam with a very careful quarantine to start support for economic development. We also suspending all commercial international flight coming from departing from pandemic era as soon as the first case was confirmed. But we starting some kind of commercial flight from some country in the region, as I said, to ensure the development of economy. For example, we start flying from Korea to start with a lot of economic zone expert to come for continue with working for working in Vietnam. We also require all Vietnamese and international visitor who return from abroad to quarantine at centralized facility for 14 days. And for nearly 7 months, the government pay all the money for the quarantine, regardless they are Vietnamese or international people. But at the moment, from the 1st of September, we start taking some fee from the people they would like to come to work for Vietnam and some people to visit Vietnam as well. And we also have some kind of financial support and tax delay for vulnerable group that helping them to overcome the problem during the COVID-19. And in terms of how we containment apply containment measure to control the spread of COVID-19, and you can see in the screen is that we do very strictly contact tracing. We have the with the infection prevention and control in healthcare setting, and this is very strictly because we have a lesson learned during the second wave in Vietnam, which cost nearly 35 lives because of the COVID-19 spread in the emergency and some department in the some hospital in the center. So now we apply very strictly infection prevention and control in health setting. And also we have a targeted lockdown, not the whole country, but some area. And also we have a mass gathering, traveling and mobility restriction. And very importantly, we have a very clear, consistent and creative public health message. And maybe you can know that we have a very famous the song that right from the beginning of the COVID-19, that is again COVID, and it is broadcasted as a very good example in CNN. Also, we do very good contact tracing with the degree contact. And quickly, you can see that we are not only following one level, but we following the third level. And the diagram here showing to use how we contract. So it is the third level, is this one from the first, the second, the third. And even for some area, we also continue to following the other one. So with that kind of contact tracing, third degree contact tracing, we have a very good to measure to contain the spread of the epidemic. So now I would like to share with you some lesson learned from Vietnam that we documented, and we also maybe other country can look at and see whether we do the same or different, and we share experience to each other. The first one is a very good investment in the public health infrastructure, and that would enable our country to have a head start in managing public health crisis effectively. The second is early action from government and the community, ranging from the broader closure to testing to lockdown, and curb community spread before. Through our contact tracing, as I mentioned, also very good measure and experience. Quarantine beyond the possible exposure rather than symptom only also can reduce a symptomatic and pre-symptomatic transmission, and clear communication is crucial. Clear, consistent, serious narrative, and also very dissemination of the message. And finally, but not last but not least, but also very important from the social perspective, is that we have a very strong whole of the society approach and engage of multi-sectoral stakeholder in decision making process, and very activate cohesive participation from different stakeholders, especially from the community, from the grassroots level, to support the government. Uh, Apart from that, we also have some lesson that very typical for Vietnam and maybe not replicate in other country, but it may contribute to the success of Vietnam. That is, we have some experience with the past of epidemic because Vietnam is a country we have to combat with the SARS
Professor
before.
Nguyen, this
Yes.
is to let you know to please wrap up your presentation.
Yeah, and we also some lesson, and we also have the party that is actually very important to direct from the top to the down. And finally, I just have a slide to share with you some rapid analysis of social challenges. And it is maybe similar but different with other country, but I see that it's quite similar with the presentation from Zakia, where we have a lot of challenge. Women, vulnerable group, ethnic group that actually have a lot of impact and big impact on the pandemic. So that's all of my presentation related to the success and also challenge from the combating COVID-19 in Vietnam. Okay, so thank you very much for your listen. I am happy to share with you and discuss later. Yeah, thank you.